I'm joined by Martin Whyte today here at Martin Whyte Christmas tree farm, wood processing, general contracting, snow removal business. Martin has been a long time entrepreneur in Lanark County, deals in many of the municipalities throughout the area. And I wanted to talk to Martin today to get his perspectives on what's happening in our community, what's happening during this COVID period of time. I think too often we hear from and we rely on experts, and there's a real proclivity to only hear from experts. I think it's important that we hear from everybody.
Right.
So Martin, thanks for having me out to your shop today.
Thank you.
Even though we came out and said that you're an essential worker.
Yes.
I think we could make the case that the government saw you as an expendable worker, that your safety wasn't as important as the white-collar professions. So maybe if you just give us a little bit of a take, Martin, on some of your experiences and of trying to keep a business running, trying to keep employees working, and trying to keep head above water during these turbulent COVID times.
Right. So, I mean, when it first came out, I totally agreed with everything they did because we didn't know what was going on and what was going to happen. And based on the numbers, 100,000 deaths, we're assuming that everybody that we know, somebody's going to get it.
Right.
As time went on, I mean, my bookkeeper was off for 3 months because she lives with her father and she was deathly afraid, how would she feel if she brought it home and gave it to her father and he died?
Right.
She'd be devastated.
Yeah.
I had other employees with the same issues who didn't have a choice but to come to work.
Right.
I did have...
Who were fearful of bringing the disease or catching
taking it back home, yeah. When they announced the CERB, I had a couple of employees who decided that they weren't going to stay working and went home.
Yeah.
And who, to be perfectly honest, didn't really want to come back to work.
Right.
And the government mandate was, if the only way I could get them to come back to work was to rat them out.
Right.
And say, he doesn't want to come back to work.
Yeah.
And then he would be forced to come back.
Yeah.
That didn't put me in a very good light with my employees.
Yeah.
And there are certain people who absolutely need it.
Yeah.
People who can't go to work because their work has been canceled.
Yeah.
And I totally support it.
Yeah.
It's a government program. They're not all run right. Most.
Yeah.
But my issue is that with the evidence that we've had now for having lived through this for 6 months, and my perception of the small impact that it has had on our population, I can't hire more people because if people just don't want to come to work, why would you go to work when you can sit at home and make $2,000?
Yeah.
We have had very little COVID in Lanark County, Eastern Ontario. So it has made it tough for me to hire employees, to get work done, to keep up with the demand for work. Right. Obviously, our work demand has slowed down from previous years because there's people at home. So it's kind of a catch-22. The other programs the government have put out, the wage subsidy, has been very helpful for me. It's allowed me to keep going at more or less the same financial pace and maintain where I'm at. So I can look at, okay, I don't have to lay people off.
Yeah.
I can keep them working. Yeah, some of them are doing make-work projects. We're getting around to stuff that we haven't, that we've needed to do for years. Yeah. And I've been able to keep them here working, which is great.
But that's the program where the federal government will pay up to 75% of the employee's wages.
Yes.
And I think there's some maximum that's on that as well.
Yeah.
But essentially 75% of the wages for your employees are being paid for by the taxpayer right now.
So I think that's been a far more beneficial program than the CERB. Some people might disagree with me, but at least I'm putting the money back into keeping the employees, and maintaining the jobs and keeping the business going, which at the end of the day is really what we need. We need business. This has really, really hurt our economy. how it's been brought out, how it's been expressed to the public through the professionals, it's been very confusing for a lot of people. I still speak with people every day who are deathly afraid and are, you know, you'd think they were going to get COVID and die tomorrow.
Yeah.
And then I look at the facts and what even, you know, the health units and the health professionals are saying, and I go, it's affecting such a minor percentage of our population.
Well, just to clarify that and give the facts, so here in this area, the area that I represent, that covers the 2 health units of Lanark, Leeds, and Grenville, and Kingston, Frontenac, Lennox, and Addington health units, that's a total of 400,000 people in this 2 health units. We have had a total of 49 deaths in long-term care in this area. Outside of long-term care, we have had a total of 3 deaths. And the average age of those 3 deaths was 86. Still find this huge contradiction of that it was safe enough for you and your fellas and your men and women to be at work.
Right.
But it was unsafe for the white collar, and I don't think that's been examined enough. And I think, you know, we need to take a look at why we thought your Christmas tree farm, your wood processing, firewood processing, why your renovations, all those different elements of your business, it wasn't too dangerous for you to go to work.
I did find that curious. I have friends who work as PSWs, and I know they're all underpaid. I freely admit it. I couldn't do their job. You couldn't pay me enough to do their job. I don't even think I could do the job.
What's been your experience? Have you had much involvement with municipal or provincial government during COVID?
Yeah, I've got 2 guys who are waiting to take driver's tests.
Right.
So they can't advance up the ladder, if you will.
Right.
Because of that. We've also had issues with delays getting jobs moved ahead through the government.
Right.
So we didn't have a whole lot of building permit issues because we didn't have any building permits until recently that we required, but I did have several other projects on the go that were definitely held up by the CERB. I was in the middle of doing a severance, and it's been pushed back well over 4 months. Unfortunately, because they were working not at the office. I think the whole process, everything with government is ground so much slower because they can't have the stuff at home, and you know, it's been frustrating. I can't call and get anything dealt with as far as licenses. I get these emails from them saying, you know, it's time to renew your this or your that, and I try and pay it, and I can't get in touch with anybody to pay it. So it's been very annoying that way. Definitely slowed our ability to get stuff done. Right. In an expeditious manner. The big things that we've run into as contractors right now is that there are almost zero supply of pressure treated wood. I cannot build decks for people. I can't build foundations. I can't do this and I can't do that. And what I'm told is, well, they have it in the store, but they can't get shippers to come in back from CERB. They're sitting at home. They don't want to come in. You know, or the factory was shut down for a few days because of COVID. And then when they went to retool, well, you know, everything went to hell in a handbasket. There's been a lot of that type of stuff. The supply chain is completely
well, we've seen that.
I had a customer the other day who could not understand why we couldn't build them a deck. And I'm like, there's no lumber. You know, what do you mean there's no lumber? You know, people that aren't seeing this. And again, this, I think a lot of this has been brought along by what now appears to be, or what I feel, is they're continuing on with this, be afraid, be afraid, be afraid. And when I look at the facts, I go, be careful? Why do I need to be afraid? Can I not be careful? Can we not pick it up a little bit and see what happens? We can always regress. We can go back to being locked down if we had to. I don't know that we need to, but...
Or even if it had any, you know, what was the net benefit, if any? Like, we haven't even evaluated that or examined it yet.
The damage that has been done to the economy the damage that has been done to people's livelihoods. From what I understand, 30% of the small businesses are shutting down, mostly restaurants.
Yeah.
They're starving to death.
Yeah.
We've got families who can't see each other still.
Yeah.
I mean, this is 6 months and you haven't been able to see your child.
Yeah. Yeah.
There's a lot of mental damage being done to people. The big one that I hear is all about people dying from overdoses because they're going back onto crack or whatever drugs they're overdosing on because they have nothing else to do. And I'm thinking, well, I have a child who's special needs.
Yeah.
I've always been her support system.
Yeah.
She is fortunate enough that we have social programs to help her live on her own as independently as possible, assisted living. But because of COVID, I can't go see her.
Yeah.
She can't come home for the weekend. If I bring her home, she's not allowed to go back to her house, her living accommodations, her apartment, until this is over.
Because she's come to see dad and mom.
She can't come home.
She can't come home.
Without threat of losing her place to live.
Yeah.
And indefinitely.
Yeah.
Until the government says it's okay for people to socialize.
Yeah.
I know another family who has not physically been able to see his child, who's another special needs child. Since it started, I think last week was the first time he saw him in 5.5 months.
Right.
And some of these little kids, and my daughter's 27, but some of these kids who are on special needs, they need those
and
social
being
interactions.
prevented from seeing their family.
They need those social interactions for their mental health.
Yeah.
My daughter had several breakdowns on the phone because she couldn't see us. And that's what they know. That's their stability.
Well, the stability, support
stability,
system, it's their,
you know, and when you start changing their systems and the things that they do and take away those support systems, they're not they're being affected mentally because of this. Is the damage that we're doing in trying to prevent COVID spread causing more harm than good? And when I look at it, I go, okay, we've got mental, physical, emotional, monetary, economy,
education,
all
access
this
to
stuff
healthcare is
being affected by what the facts are showing right now is correct me if I'm wrong, like a 0.04.
Well, forget percentage, but just again, and this has been pretty much a similar number since. We saw the numbers drop off substantially through April and May, and since June, the numbers yesterday, the numbers today in Ontario, we tested 18,800 people for COVID yesterday. We found 108 people were positive.
Right.
But what was interesting in those numbers, and we see this every day, the ministry does not report how many of those people were hospitalized.
Right.
They do report that if there was a death, but there hasn't been, there was no death reported today, none yesterday, none the day before. Like, I don't know when it was the last time. But we have just about 0 deaths. We have, I know this, our total number of people in Ontario hospitals today is 40. Okay? And that's a population of 14.5 million people. We have 32,000 beds in our hospital system, and 40 of them are being occupied by people who have been tested positive for COVID. So is it truly justified to cause so much harm and damage to so many people who aren't at risk?
And I view it along your lines. We were able to go out and continue working. None of my people have gotten COVID, which I'm very thankful for, at least none that we know of. We did take precautions. We put some jobs off. We didn't go to their houses. We made them leave, et cetera, et cetera. So it's definitely affected us. Perhaps us not near as much as a restaurant or whatever. But I really, 6 months later, looking at the facts, have to question, why are we still in lockdown? Why is the government, not federal and provincial, not having democracy? Why do we have no democracy in this province? We can still sit and vote. If we can go out and work Why can't you
I
go
should
to
be
work?
able to go and debate a bill and vote on a bill.
I completely
if
agree.
you can work, I should be able to work as well.
And
full time.
as you alluded to earlier,
Yeah.
why do all the white-collar guys get to go home and us blue-collar guys stay out in the front lines?
Yeah.
You know, it really makes me question, and I believed in Doug Ford and what his original mandate was. I thought he could bring some welcome change to this province because I did not believe in
Well, didn't we all?
the previous administration. But now I'm questioning, has the power gone to his head? Has the ability to rule on his own?
Yeah.
I look at the facts
Yeah.
and the damage, and I go, we've caused way much more damage to my mind
Yeah.
than what we have prevented.
Right on. Well, listen, Martin, it's always a pleasure to have a chat and
Good
a
to see you.
conversation. I'm
I've
glad to see
appreciated
that
your
you're plugging along and that the Christmas tree business, hopefully that's not going to be impacted. Hopefully the Christmas tree season will be good, the firewood season, and
Everybody always needs firewood, COVID or not.
Right
we
on.
have lots of it.
right on. Okay, good chatting, and we'll talk again.
Thank you, Randy.
Bye-bye.